They're known as deaths of despair. Since 2017, at least 300,000 American lives have been lost to alcohol, drugs and suicide. Now the Wellbeing Trust is warning the impact of COVID-19 on mental health could kill another 75,000 people over the next decade.
This is on top of the deaths of despair that we would expect to see annually. So it is quite a few lives when you look at it, but when you consider the lives that we're already losing to deaths of despair, it actually does become quite disturbing.
New York State has partnered with charities like Crisis Text Line to help provide mental health support for frontline healthcare workers. A survey of helpline services found 49% reported a rise in call numbers when the pandemic began.
Crisis Text Line has certainly seen an increase in the use of the word COVID or pandemic as a part of the reason that people are calling and that people are in crisis. Yes, there is an increase that call centers in general are experiencing related to despair or hopelessness in calls.
Public health experts say previous disasters like Hurricane Sandy caused similar problems with increased economic hardship, isolation and anxiety. They believe the repercussions of the current crisis must be taken as seriously as the virus itself.
Every time we've studied it, we've seen the same thing, and I expect to see it again, which is a very enduring mental health impact of the event that is not just specific to the event itself, not just to the virus and how people may be exposed, infected, sick, and unfortunately die, but to all of the cascading consequences of that as well.
The federal government says it is taking steps to protect people's mental health, and more than $400 million has been allocated to the Substance Abuse and Mental Health Services Administration in response to the pandemic. But some experts are calling for more.
What we need to be doing is to look at these trillion-dollar packages that are coming out of our Congress and invest some of those dollars meaningfully in mental health. If we do that, I believe that we actually could have a fighting chance to get through this and do it in a way that we won't lose as many lives. If we don't, then I'm afraid we're really just adding a problem on top of a problem. And when this is all said and done, we're going to have a massive problem on our hands.
The Wellbeing Trust says deaths of despair had recently begun to level off in the United States, but without urgent action, that could be reversed by COVID-19. Sarah Walton, CGTN, New York.